Okay, so welcome back, and today we are going to cover the roles and responsibilities of a pharmacy, and we're also going to cover the roles and responsibility of a pharmacy technician. We're going to talk a little bit about education of both the different types and what it takes to become a pharmacist compared to a pharmacy tech, and then a little bit about the job outlook. So, first off, in today's pharmacy, there are new medications being released to the market on a daily basis. And it is the pharmacist's job to make sure that they are familiar with these new drugs and understanding all the potential interactions and detect any potential errors that might occur um, uh, when medication orders are placed to prevent harm to a patient. And I'm not sure if you took the opportunity to watch the Dennis Quaid story about his twins, but if you have not, it is posted in here as well. And it is a must watch to really understand the importance of being a pharmacist and a pharmacy technician, and that there really is not room for errors. One little mistake could truly affect somebody's life. So knowing that you are a professional as a pharmacy technician and that you are going to be taking care of patients and making decisions and on or providing medications for them and making sure they're getting the right medication. The Dennis Quaid story is about they're twins that ended up getting a drug called heparin. And heparin is a drug used to prevent clotting of the blood. So we call that an anticoagulant. And if blood can't clot, these babies, these newborn premature babies, can bleed out. And what happened is they went in for a staph infection and they had a small catheter. It's called like a Hickman catheter or central line catheter put into their large artery into their heart, their aorta. And to prevent blood from clotting into that port, they put a drug called heparin lock in there, which is a very, very small dose of heparin, like a diluted out dose of regular heparin. And what ended up happening is the trays that are filled for the staff to use for heparin lock was actually filled with regular heparin. So that's 10,000 times more or a higher dose of heparin than what the heparin lock would be. So the nurse pulled the medication from the drawer that was stocked by a pharmacy technician, and the labels looked exactly the same. And if you have never seen the label between heparin and heparin lock, they are very similar. And let me see if I can find one for you. They're both very similar. They both have like a blue coloring to them. Um, Often you can't tell a difference. Um, so here is an image that I am going to put right down here. Hopefully it'll paste in here. But that's what it looks like. This is heparin solution 1,000 units, where this is a heparin flush, which is 10 units. So that was the difference between that particular baby. So basically their blood became water. They were unable to clot. So they had to reverse that effect, which took a drug called an antidote called vitamin K to try and reverse that response. And it was very dangerous to the babies. They could have died. There was a lot of ethical issues in this, like they didn't inform the Quades as soon as it happened. They kind of kept it quiet. But one simple mistake by these two vials looking so similar was it actually started with a pharmacy technician. So that in mind, knowing your role as a pharmacy technician is really important. You do a very, very important job along with the pharmacist. So let's take a look at what the role of a pharmacist is. Of course, they are the main focus of a pharmacy. If you look into a pharmacy and you go to like CVS or Walgreens or wherever, and you look back there, the individual in the white coat, which looks like this gentleman right here, is usually the pharmacist. The pharmacy technicians typically will be in like dress clothes or professional dress or scrubs, depending on. This is all the duties of the pharmacist. I'm not going to read them to you. A few really important ones. One is counseling patients on possible side effects and adverse effects. So a lot of you guys don't understand what's the difference between a side effect and adverse effect, and I'm going to talk about that here in a second. But screening patients for chronic disease, pharmacists do that? Yes, they do. They look at their medication orders. They see if they have issues. A lot of times patients will come in and talk to a pharmacist like, I've been having these issues. What can I take for it? And they will be like, well, that sounds like high blood pressure. Let's go ahead and take your blood pressure, which typically they have a blood pressure machine right there in a pharmacy. So they do a lot of things that are very direct patient care. What are the difference between an adverse reaction and a side effect? So here is the difference. An adverse reaction is unintended pharmacological effect that occurs when a medication is administered correctly. It is an effect that occurs unintended. We didn't expect it. Sometimes there's type A adverse effects, which are predictable. They're more common depending on, and they could be mild, moderate, or severe. There are some adverse effects that we've seen that we're like, yeah, we've seen that before, like anaphylactic shock. We've seen that before, but it happens so rare that we call that an adverse effect. Type B is unpredictable. Had no idea that would ever happen. Nothing to do with dosing or anything like that. A lot of times a predictable is maybe it's a higher dose and we may see some adverse reactions. I'll come back to the examples in a second. A side effect is a secondary unwanted effect that occurs due to drug therapy. It's undesired typically. Sometimes side effects are good, but it's usually undesired, commonly foreseen, meaning that when we tested the drug, a lot of patients may have taken this drug and had a headache. And so that's listed as a side effect. Example, Benadryl. Okay, Benadryl causes, how many of you guys have taken Benadryl for allergies and you got drowsy? That is a common side effect of Benadryl. Now, another adverse reaction for Benadryl would be experimental symptoms, which is like usually seen in elderly, and their like hands will shake because of Benadryl. And that is not normal. That is an adverse reaction. That's not something we can predict. Like we can predict drowsiness and said, don't take this in the morning because it's going to make you sleepy. But the experimental symptoms is not normal, and we typically wouldn't see that. So that is the difference between an adverse reaction and a side effect. And this is where a pharmacist needs to spend a lot of their time. Because if a patient comes in and says, I've been having these shakiness and I don't know why, their question is going to be, well, what medications are you on? They may list their medications that they're prescribed, but they never think about over-the-counter medications, which Benadryl is an over-the-counter medication. So you're going to want to say, well, are you taking any over-the-counter medications? And that's when they may say, oh yeah, I've been taking Benadryl, I've been having allergies, and ding, 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 the pharmacist is going to know, ooh, that is an adverse effect. So knowing what drugs have those is really, really, really important. And they have to spend a lot of time studying and learning those so that they're able to help their patients. So pharmacy technician, what are their duties? Well, honestly, the pharmacy technician there is not one pharmacist out there that can do their job without a pharmacy technician. A pharmacy technician is critical to a pharmacist so that they can get their job done. Otherwise, they'd be spending their whole day filling medications, and that's the pharmacy technician's job. So pharmacy technicians inputs prescriptions into the computer and checks for accuracy 100% of the time. Prepare prescribe prescriptions, retrieve, weigh, pour, count, measure, at times mix, count tablets, and label bottles. Those are all, and if you make one error, it can really affect somebody. Deliver medications to patients. Like I talked about the Quaid babies, the pharmacy technician filled the medication tray and took it to the NICU, which is the nursery intensive care unit. And he or she put the wrong one in there. So they deliver medications to floors. Typically, we see that in inpatients. Sometimes you can even see delivery systems at outpatient pharmacies, like CVS may deliver medications to places. Engaging with customers, being able to answer the phone, handling patients' questions, referring to patients to the pharmacist when they need medication counseling. That's the one thing as a pharmacy technician that is super important to know. You cannot counsel a patient on medication. If a patient comes in and says, "What do I do? I'm on this medication. What's wrong? What's going on? What is it going to do to me?" You have to get a pharmacist. That is not your job. That is against the law for you to counsel them. So that will be a question on your board exam. So write this down and know you cannot counsel patients on medications. You will also contact physician offices for refill requests. Maybe you'll look at a prescription and not understand it, and you may need to contact the physician to find out more information about it. You're going to be a cashier, you're going to stock shelves, you're going to handle inventory, and assemble patient medication profiles and history and check for accuracy. So very, very important things to do. So education-wise, education for a pharmacist. Most of them are PharmDs, known as a doctorate of pharmacy. They are the experts. Usually in the US, you pretty much have to be a PharmD. In some other parts of the world, there is a bachelor's in pharmacy and you're a registered pharmacy. Probably in the late 1990s, early 2000s, most programs moved to PharmD programs. There are such a thing as 0 to 6 year pharmacy program where you can start in right away and go into pharmacy programs, which means you have to complete this PCAT exam prior and you can apply and get right in and do your 6 years. But the more common route is pre-pharmacy undergraduate courses. So you usually take 2 years of pre-pharmacy undergraduate courses, which consist of these courses here. And then if you do well, you take your PCAT, you apply to pharmacy school, and it's 4 more years following that. In pharmacy school, typically your 4th year is an internship hours or an externship where you go out to pharmacies and hospital pharmacies and practice as a pharmacist, but you're not getting paid. Just like you guys are going to do your pharmacy rotations as well. It's very similar. Obviously, theirs last a lot longer. And then once they finish and get their degree in pharmacy, before they practice, they must pass a national standardized exam, board exam. We call that a BOC, Board of Certification exam. And then they must take a state-specific law exam. Depending on what state it's in, it's going to vary. Some states require another exam on top of their national board exam. Some of it's state to state. It just depends. And then to maintain your pharmacy licensing, you have to renew annually or biannually, depending on what state. And typically you have to do 30 hours of continuing education. So for a pharmacy technician education, they are typically programs that are accredited by ASHP. Oh, what does ASHP stand for? Somebody look that up because I can't remember off the top of my head. They changed it a couple years ago and I can never remember it. They usually include courses like what we're taking, Intro to Pharmacy, Med-Term, Pharmacology, in and outpatient. You guys are going to be taking, I think it's institutional and community pharmacy, calculations next semester, which will most likely be with me, and compounding. Law, we're going to cover some law and regulation in this course, and communication and professionalism, which we're going to cover in this course. Most pharmacy technicians complete a certification program, but it is not always required. Some can work as a pharmacist for a few years and then go take their exam, but they have to clock so many hours and it's a lot. So it would be hard to do. So the easiest way is to take a program like you guys are. And then when you finish your program, you can sit for the National BOC Board of Certification. And then you're going to register. Once you pass that, you're going to register in whatever state you practice in. So wherever you're practicing, that's where you would register. Let me bring you guys down a little bit so you can see. Okay. The national certification, these are the two options for pharmacy technician. There is the This one, this exam, a certification of farm tech, this is sponsored by NHA. This is not accepted in all 50 states. This is not the recommended route. It is possible. It is accepted in Texas, but we use the sponsored Pharmacy Technician Certification Board, PTCB, and this is the exam, certification exam, and this is considered the gold standard, and it is accepted by all 50 states. So all 50 states accept this exam. So this is your better. So you can move anywhere in the country when you graduate from high school or wherever you may go to college, or if you are a Gen Pop, you want to move somewhere, you can move somewhere and not have to worry about it. Once you pass this, you do have to register in the state that you're in, wherever you're practicing. But typically not another exam. Here is just the requirement for different states must have a registered license. So if they're in green, these states require you to have your state license and your PCTB, the pharmacy certification exam, must be a national certification and registered or licensed. So these, you have to take the national one for sure, um, and registered to license. These must be registered or licensed. And then in these states, it's not required at all. So just a couple states, Pennsylvania and Wisconsin, but pretty much all the other ones in Hawaii require you to have your license of some sort. State licensing, I put a couple links in here because it might be helpful. I'm not sure where you guys plan on moving, if you plan on staying in the state of Texas, but following passing of the board exam, you must register with the state in which you are practicing as a farm tech. There may be a state exam as well, depending on the state in which you practice. So if you're curious, you can click on this link here. It will take you to, there is the link there. And I'm going to hold this up. This will take you to a site which will tell you what each state requires. So if you want to look into that, you can. And then this one is the pharmacy.texas.gov, which is the State Board of Pharmacy for Texas. So when you are trying to fill out your paperwork for your tech in trainee license, this is where you're going to go to do that. And finally, your professional outlook. What does this profession look like for you when you complete and you get your certification? A little bit about pharmacy tech. You guys are going to complete the general basics. So you can take the basic pharmacy tech and work at Walgreens or CVS or Tom Thumb or wherever you want. But if you want advanced practices, there are many advanced practices available, and it can move you up the ladder a little bit quicker. You can get advanced practice in like vaccinations, so you can learn how to do vaccines. You can do advanced practices in compounding, so you can get your compounding cert, which is the level 1 certification that we offer here, and it's a summer class. So if you're interested in that, you have to take a few more classes and then you complete your level 1 cert. I'm not sure 100%, you can check in the handbook, but I believe there might be a few other classes like MedTerm and Patho that you need to couple with it. And then so there are some opportunities for growth in pharmacy technician. As far as the basic pharmacy technician, there is a link here that will show you the outlook. And then the median pay says right here around $17.66 per hour. What is required? The job outlook is slower than average right now. It says it's only 4%, but that's national. If you look in the state of Texas, it's much higher because especially in Collin County, because we're a growing county, so you will have no trouble getting a pharmacy technician job when you graduate or when you complete this program. So that is all I have for you guys today. And if you have any questions, again, always welcome to email me. Thank you.